Hi, my name is Tina. I'm a registered nurse. I work at the Scarborough Centre for Healthy Communities with the InterProfessional Primary Care Team as a nurse navigator. Today I'll be talking to you about the basics about the coronavirus. So what is coronavirus? The coronavirus is a type of virus, and viruses are tiny little germs, small enough that they can float in the air on little drops of water. They can be found on skin like your hands and face without you even knowing. And if they get inside your body, they can make you sick. There are different kinds of coronaviruses, but the one you've been hearing about lately is a new kind that can cause an illness called COVID-19. How do people get sick? Scientists and doctors don't know everything about the new coronavirus yet, but they're working on it. The coronavirus lives in the saliva of people that have COVID-19. Saliva is the fluid or liquid that is found in your mouth, nose, or throat. Coronavirus germs can be found on hands of an ill person who has touched their mouth or nose. So this is a picture of a person sneezing, and you can see the drops of saliva coming out of his mouth and nose and floating in the air. These tiny drops of saliva can travel in the air up to 6 feet or 2 meters. And if this person is sick with COVID-19, his drops could make you sick if the drops get into your body. This is why nurses and doctors are telling us to wear face coverings or face masks when indoors and around people you don't live with. In fact, now by law, you must wear a face mask or face covering in all indoor public spaces. How do people get sick? You can get sick with COVID-19 if the germs get into your body, and this can happen in two ways. First, from drops of saliva floating in the air that have come out of a sick person's mouth and nose when they talk, cough, or sneeze. If these tiny drops get into your body through your mouth or nose, then you could become ill with COVID-19. Second, when people that have COVID-19 touch their face, either their mouth or nose, and then touch surfaces that everyone else touches, for example, a sick person coughs or sneezes into their hands and then opens a door, touching the doorknob or handle, without washing their hands. Later, you touch that same doorknob, and if you touch your mouth or nose, causing the coronavirus germs to enter your body, you could get sick. The coronavirus germs can live on these hard surfaces for hours. One of the most important things that you can do to keep your family and yourself safe is to wash your hands. It is important for you to keep your hands clean. You can do this by washing your hands with soap frequently. This will kill the coronavirus germs that may be on your hands. Also important is to cover your mouth and your nose when you cough and sneeze. Cough and sneeze into the inside of your elbow. Wash your hands regularly and frequently with soap for 30 seconds or with an alcohol-based hand sanitizer. Keep all commonly touched surfaces clean by washing and disinfecting them. Avoid touching your mouth, nose, and face without washing your hands. This diagram shows you how to wash your hands properly. Remember to scrub both your hands with soap and don't forget about your nails, thumbs, and wrists. What happens when a person gets the coronavirus? Some people don't feel anything at all, and others may become very ill. Children typically do not have many symptoms of the virus, or they may have some mild flu-like symptoms. but they can still pass it on to other people who might get very sick. People who are sick with the coronavirus may have a cough, fever, sore throat, headache, runny nose, muscle pains, and a loss of sense of taste. Some people can get very sick from the coronavirus. They may have a hard time breathing and have to go to a hospital. Some people, like older individuals, can die from coronavirus. Physical distancing. Physical distancing means staying at least 2 meters away from persons you do not live with. If you think back to that picture of the man sneezing, with all those tiny drops of saliva coming out of his mouth and nose and moving through the air, those drops can float and linger in the air for a while. You do not want those drops getting into your body. This is why we must practice physical distancing. The experts say that 2 meters or 6 feet is the safe amount of space to keep between you and other people. What can I do? Everyone needs to go outside sometimes for groceries and other essentials like medications and appointments. It's important to remember to practice physical distancing. When going outside, to keep yourself and your family safe, it's recommended that everyone stay at least 2 meters away from anyone who you do not live with. When this is not possible, you must wear a mask or some form of face covering that will cover both your mouth and your nose. When out in public spaces, avoid touching your face and remember to wash your hands with soap for 30 seconds or with alcohol-based hand sanitizer. A great way to be sure that you've washed your hands for long enough is sing the happy birthday song to yourself twice while washing your hands. This diagram shows you how to wear a mask properly. It is mandatory that everyone wear a mask when indoors in public spaces. For masks to be effective, it is very important that we wear masks correctly. The mask must fit your face, so it shouldn't be loose, and most importantly, the mask needs to be worn in a way that it covers your nose and your mouth. It is important to stay at home as much as possible in order to keep everyone safe and healthy. This is why we've been staying home from work and from school for the past few months. Enjoy this time with your families. Go for a walk, go for a bike ride, have a movie night at home with your family. Most importantly, stay safe and have fun. You can find more information about the coronavirus by clicking on these links here.